Hello, everyone. Good afternoon, everybody. I'm Priyanjali from Prostate Wellbeing Team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, which is benign prostatic hyperplasia, or what we commonly call as BPH. Benign prostatic hyperplasia is the non-cancerous enlargement of the prostate, which usually begin in 50s in men and which in many men cause obstruction to urine flow. Many men have to get up in the middle of the night, and it is the most troublesome aspect of this condition as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending event such as theater or cinema rather difficult. A doctor such as urologist can treat this condition and help the patient to get relief. To throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Shailendra Kumar Gupta, MS General Surgery, DNB Urology. He has a rich experience and hands on expertise in stone management as well as in treating urological problems. He is currently practicing at Apollo Medics Super Specialty Hospital, Lucknow. Dr. Shailendra Kumar Gupta has rich experience in the field of urology and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring the patient health is in safe hands. Over to you, doctor. आज आपके लिए हमारा सबसे पहला सवाल यही होने वाला है कि बीपीएच क्या है, अगर आप अपनी भाषा में हमें बता पाए तो.
Okay, thank you. And hello everyone. So basically, what is prostate? So prostate is a vital organ. It is situated between the bladder and passage of the urine surrounding the urethra, and in between the bladder and rectum. It is near about walnut site and near about 12 to 15 gram. So BPH is not it is benign enlargement of the prostate. It is basically age-related procedure. It is not a disease process. It is age-related. As advanced, near about the fifth decade of the life, once men entered in fifth decade of life, the prostatic enlargement occurs, and because of this enlargement, certain patients having some symptoms like frequency, urgency, nocturia, etc. Because of this enlargement of the prostate, it is a non-cancerous condition.
Right. Right. डॉक्टर, सबसे पहला बात ये है कि सबसे बड़ा मुसीबत, सबसे बड़ा समस्या जो होता है इज आइडेंटिफाइंग द डिजीज. एज यू सेड दैट एज एक बहुत बड़ा कारण है इसका. इसके अलावा कोई और कारण, एंड हाउ डज द अर्ली सिम्टम्स लुक लाइक?
Yeah, besides other than the age, some genetic factors are there, but there was no definitive cause of BPH. So initial symptoms, first initial symptoms is the frequency, patient complaining the increased frequency of the urination, having urgency, and in urgency he is having difficulty to hold the urine and urgent incontinence, and sometimes he passes the urine before going to the washroom. Some patients having the increased nocturnal frequency of the urine, as you say, multiple times he sleep or disturb and he wake up, go to washroom, then again sleep. So nocturia occurs, urinary incontinence occurs, and sometimes the sense of incomplete voiding. He goes to the washroom, passing urine, but he feels that complete urine was not clear.
Right.
And sometimes having the eye straining, etc.
Right. So the symptoms which you have just mentioned, doctor, if we compare it with the diabetic patients, aren't the symptoms of diabetes almost the same? How can we differentiate between the two actually?
Yeah, basically, in diabetic patient, symptoms occur due to the diabetic cystopathy. That causes the increased bladder volume, and because of that increased bladder wall becomes lax and less pressure generated. So patient presented like similar symptoms. But on examination and detailed clinical history, if there is a uncontrolled diabetes and symptoms persistence in long duration, patient having the large volume of the urine, so it may be due to the diabetes. But if a patient having the on examination large prostate and other symptoms are there, so it may be due to the BPH. But symptoms basically in prostatic symptoms or diabetic symptoms, uh, they intermit.
Right. Among these symptoms, because we are talking about symptoms, among these symptoms, which can be the most troublesome symptom for a patient
Yeah,
who is suffering from
uh,
BPH?
most troublesome symptom is the nocturia.
Right.
Patient having the nocturnal urine frequency, and he goes to the bed. After some time, he wake up, go to washroom, then again go to the bed, then again go washroom. This is the
Mm,
most basically problematic symptom. Some patient also having the incontinence, urgency. Because of urgency, he can't attend the social gathering. Like suppose that he goes to the market and suddenly he feels urge of urine and he can't control that urge. So here near research for washroom, this symptoms is also problematic. And other than this poor flow, sometimes patient having the sense of incomplete writing. These are symptoms, but main symptoms nocturia and urgency or incontinence is more problematic for the patient.
right. So, doctor, are there any chances of occurrence of infection as well for the patients who are
Yeah,
suffering
yeah,
from BPH?
yes. If patient having the in chances of infection increases, because
Hmm.
if there is high residual volume,
Hmm.
residual volume means patient go to the washroom. After that, the volume retained in the bladder,
Right.
residual volume. So if patient having the high residual volume, there are chances of increased infection in this case.
Right. Right. And what if a patient is have intaking some less amount of water, because there is always a tendency of visiting the washroom again and again. So a
Yeah, yeah.
patient might avoid water. So what can be the
Basically,
worst scenario?
adequate amount of water needed for the body.
Hmm.
In ideal condition, if patient passes 1.5 to 2 liter of urine in a day,
Right.
then he should take about 3 liters of water in a day, because 800 to 1 liter urine, 1 liter of water loss is the insensible loss. If we take less volume of water, your question is if we take less volume of water,
Right.
uh, then pressure increases in our kidney, and that may go into the AKI. Sometimes patient having the diarrhea or any other cause and undergone the dehydration. So less amount of water causes the dehydration. In that case, kidney suffers.
Right. Right. So, doctor, how much water do we usually recommend the patients who are suffering from BPH if they have a
Yeah,
normal lifestyle, a regular lifestyle?
yeah. So basically, amount of water depends on the patient condition, patient living standard, and working. If
Right.
suppose that any patient working in field and
Hmm.
hard working and having the lots of sweat, then he should take increase water. Amount of water depends on the output.
Hmm. Hmm.
So if patient working in a I think sunny environment and open field, then he should take uh, more amount. And patient working in conditions like in AC environment and there was no insensible loss or less sweating, then 1.5 to 2 liters, sometimes average is 2 to 3 liters in a day is sufficient for that.
Right. Because we are talking about hydration, we know diet also plays a very important role in our life. also when we are talking about a wholesome body, diet plays a very important role. So are there any diet related restrictions or any do's and don'ts for patients who are suffering
No,
from
no, no, no.
BPH?
There is no dietary restriction for the patient of BPH. It is
Hmm,
not related to the diet.
right.
Yeah,
But
because some symptoms increases like if you take the lots of water, then your frequency already you have the increased frequency, then further frequency
hmm,
will increase. Uh, so
right.
in this case, we advise should take less amount of water after 6 p.m. or 8 p.m. So
Hmm, hmm,
because of that, your nocturnal frequency will decrease and you can take a good sleep.
right. Right. Uh, any triggers for BPH? Like most of the people nowadays are adequate to consuming alcohol and smoking cigarettes. So can these lifestyle
No, no.
pattern somehow affect?
नहीं these life these patterns doesn't affect the BPH course of BPH, but binge alcoholic. If patient
Hmm,
taking the large amount of the alcohol like beer or diluted alcohol, that increases the chance of urinary retention
right.
because in that case, large amount of the bladder having the large amount of load, sudden increased urine output that may cause the precipitation of the urinary retention.
Hmm, hmm, hmm. Right.
Otherwise,
Uh,
course of disease, course of PPS doesn't affect with this.
right. Doctor, let's also know about the diagnosis. How do we diagnose patients who are suffering?
Yeah, first is clinical diagnosis, second is radiological diagnosis. So first
Hmm,
clinical diagnosis, once patient can to us with the certain symptoms like frequency, urgency, nausea, yeah, poor flow, interrupted flow, and sense of incomplete widening or other symptoms suggestive of the lower urinary tract symptoms. We first take the proper history and examine the patient. On examination, there is distal rectal examination. In
hmm,
that, we feel the prostate correctly and we grade it grade 1, 2, 3, or 4. Okay. Then next is the ultrasound. So basically, commonly performed is the transabdominal ultrasound. It give near about 10 to 15% plus minus size of the prostate. So second is that, and on ultrasound we can also check the volume of bladder pre-wide and post-wide. So see the post-wide residual volume. And third is the serum PSA. Serum PSA basically is a screening test. It is a not related to the BPH, but it related to the screening of prostatic cancer.
right. Right. Doctor, now that we know about the diagnosis, what are the treatments currently available? Because we know that medical science has evolved drastically in the past few years. For sure, the treatments have been advancing with time, and the pain which was there before 10, 15 years, if we say,
Yes,
it
yes.
has gradually decreased. So, what are the current treatments available?
So, as I earlier told, BPH is not a disease. It is a
Hmm.
complex symptoms. So,
Right.
basically, treatment depends on the symptom. There is International Prostatic Symptoms Score (IPSS),
Hmm.
according to which symptoms patient having the mild symptoms, moderate symptoms, or severe symptoms. So sometimes if patient having the mild symptoms, only 1 or 2 symptoms that may improve with the after the daily lifestyle change. Then in that case, we just observe the patient. If they having the persistent symptoms or symptom frequency increases, symptom severity increases, then go for the treatment. Other
Hmm.
treatment is available is the medical treatment. Second is the
Hmm.
invasive treatment. So
Right.
medical treatment nowadays multiple drugs are available. These drugs comes in the group of alpha blocker and 5 alpha reductase inhibitor and sometimes uh, blocker androgen blocker and with the invasive procedure. Invasive procedure, multiple procedure with minimal invasive to surgical that through the endourological. Basically, no cut surgery. We go for transurethral resection of prostate, known as TURP, either or whole volume laser excision of the prostate, whole of the prostate removed with the help of laser. And there are some advanced techniques, prostate lift and some others.
Right. Doctor, if we speak about the surgical procedures, what are the
Yes.
current surgical procedures which are available, and also how does it normally take? How long does it normally take for someone to, come back to the same normal state
Well,
again?
yeah, yeah. So basically, surgical, as I told, surgical procedure available are in currently most commonly performed procedure is the URP or POLE.
Hmm.
URP stands for the transurethral resection of the prostate. In this, we dissect the prostate in chips with the help of electrocautery through natural process of the urethra. We don't make any cut in the body. We go through
Hmm.
the urethra, urine the opening, and dissect the prostate by chip. Okay. Second is the holed or tulip. It is basically laser excision of the prostate. We completely resect the prostate through the laser and then remove it with the piece. These are the most commonly performed. Sometimes very large gland we can go for laparoscopic and or robotic prostatectomy, but these are less common. And nowadays, very rarely
Okay, so I believe there is a network glitch. We are trying to get a doctor connected. In the meanwhile, everyone, please, yes, he's right here. Doctor,
yeah.
yes, we could not hear you for a while. You're back again. We can see you and hear you. Yes, doctor, if you could please continue. Yes.
Hello.
Yes, yes, doctor, we can
Hello.
hear you.
Yeah, yeah. Yes. Repeat your question, please.
We can hear you, doctor.
Yeah, yeah. Hello, Mr. Anjali. Can you hear me, please?
Yes, yes, we can. It's fine now.
Yeah, yeah,
So we were talking about the surgical procedures which are available, and
yeah, yeah. Yes.
right. Doctor, the medical options or the medicines which you mentioned, is it safe for the patients to consume them for a long time?
Yeah, yeah. It is safe.
Right. And if we speak about the reoccurrence rate of BPH,
Prostate.
may it be, yes, may it be
Yes.
surgical, may it be medicine, what is the rate currently?
Yeah. Basically, with medical treatment, the
Hmm. Well, we are trying to get, doctor, we can,
adjustment,
yes, yes.
adjustment.
Sorry for the network glitch. There has been a slight network glitch, but we are trying to fix the network. There are a few more questions which we would like to ask the doctor before we take a leave today. Yes, doctor, can you hear us? Can
Hello.
you hear me, doctor? Can you
Yeah,
see
yeah.
me?
Can you hear
Yes.
me?
So let's, yes, we can. Can we, let's
Yes. Yes.
continue with
So
that.
basically, prostate is, remains there.
Hmm.
You need lifetime medicine. So
Right.
medicine will need it for lifetime. If you stop
Hmm.
the medicine, then your symptoms recurs.
Right.
But with surgical treatment, your prostate will remove sometimes completely, sometimes partially.
Right.
So prostate, you are symptoms free without any medical treatment after the surgery. In some patients, after long duration, 10 year, 15 year, sometimes patient develop the again symptoms of BPH and prostate regrow. In that case, minor procedure will cure that. But
Right.
mostly, repeat surgery is not needed.
Right. Doctor, uh, how worst can self-medication be if we are talking particularly about BPH? We see a lot of patients, lot of people
Yeah, yeah,
nowadays going to the chemist and asking for medicines, or their nearby friend and dear ones. They get the medicines from them and start consuming them.
yeah.
So,
Basically, I think medicine should be taken after the advice of doctor, because we clinically examine the patient and then prescribe the treatment according to you. There are
right.
multiple medicines, and sometimes some medicine is suited by one, and other having some problem, some complication, yeah, some side effect of that medicine, because every medicine having the some side effects. So according to your age, your preference, and your gland size, we recommend the treatment. So it is not recommended to go through over the counter medicine.
Right. Doctor, also tell us the scenario where the patient is negligent about it. What can be the worst case
Yeah,
scenario
yeah, yeah.
if a
In
patient is negligent?
most of the patient of rural background, basically having some negligence, they came in very late stage, having the
Mm.
urinary retention. Most of them presented with the urinary retention, either urinary retention or hematuria, or sometimes with the high grade fever and UTI.
Right.
These patients having the long standing BPS symptoms, if not treated, causes the retention of the urine, and basically causes the a contractile diffuser or neuro like non-contractile neurogenic bladder, like paralyzed bladder. Okay,
Right.
long duration retention that causes the back pressure changes in the kidney, and patient presented with the kidney failure. This is the
Mm-hmm.
worst scenario, in which patient presented with the bilateral hydroelectronephrosis swelling, bilateral swelling in the kidney, ureter, and bladder, retention volume in the bladder, and having the increased serum creatinine, and that undergo multiple times dialysis because of this negligence. Sometimes patient presented with the severe sepsis, multi-organ failure, and ventilation, etc. These two problems are more problematic.
Right. Right. Doctor, let's also attend a few questions which are coming from the viewers. The
Yeah,
first
yeah.
question uh, is brought by Rahul, who
Yes.
asks, "What is BPH and how serious is it?"
Yeah. BPH is basically benign enlargement of the prostate. It is non-cancerous condition, and occurs only near about fifth decade of the life. It is
Right.
not a disease procedure. It is a basically age-related procedure in which prostate increases in size, that causes the compression of the urethra and bladder neck, and produces, and the patient develops the symptoms. These are
Mm.
the BPH. It is the benign enlargement and problems. So if we, as I explained just before this, if
Mm.
you are untreated and having the long-standing symptoms, you may go urinary retention, UTI, kidney failure. These are the long duration problem. Short duration, patient having the symptoms like frequency, urgency, nocturia, his lifestyle hampered, lifestyle change, he having the multiple times nighttime urine, and his sleep is disturbed, and daytime he feels sleepy. If a patient whose night sleep is disturbed, and suppose that he go out station next day morning and drive and feel sleepy, what can happen? Anything can be happen. He suffer from accident, anything. So because basically treatment is needed. either medical or surgical. It depends on the patient condition.
Right.
So neglected case can develop acute condition or severe condition like failure, kidney failure, sepsis,
Hmm.
etc. In short duration, he feel the daily his life basically his lifestyle hampered, daily activity hampered.
Right. Doctor, in the last question today comes from Abhishek, who asks, what are the side effects of the treatment options?
Yeah, usually there is no major side effect. Basically, some treatment, the medical treatment given by the patient,
Hmm.
some medicine causing the dry ejaculation, basically dry or retrograde ejaculation. It is problem in which patient after intercourse semen doesn't comes out and it goes back to the bladder. And after when he white, then semen goes with the urine pass out. Okay, so some patient having the symptoms of this, some patient having the some dizziness or dry mouth. These are the main symptoms, and no major side effect of this treatment basically.
Right. Well, Doctor, we had a wonderful discussion on the topic today, and I believe it was very helpful for our viewers. Before we take a leave, any take home message for our viewers who has watched us so far?
Yeah, my only message is that if you have symptoms of BPH, so don't neglect it. It
Hmm.
is basically 10 to 15 minutes procedure. You take appointment of any urologist nearby you and go take proper treatment. If he advised medical treatment, then go for the medical treatment. Usually, we first advise medical treatment any side, then at least 4 to 6 weeks observe the patient. If patient having improvement of the symptoms, then go for the medical treatment. Otherwise, advise for the surgical or minimal invasive intervention.
Right.
So my only advice is that don't neglect the symptoms.
All right. That was the expert advice for today. And that was Dr. Shailendra Kumar Gupta for us. Thank you so much, Doctor, for your valuable time.
Thank
It
you,
has been
thank you.
quite an informative session for our viewers today. And we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more informations and updates, stay connected on our YouTube page, Prostate Wellbeing. We are also available on Facebook, Twitter, and Instagram. Thank you. Stay safe and
Thank
stay
you,
healthy.
thank you. Okay.